Former President Donald Trump's announcement of a $50 million federal initiative to fund artificial intelligence-driven cancer research has sparked both optimism and debate across the scientific and political spectrum. The plan, unveiled at a medical innovation summit in Washington, D.C., represents a renewed federal effort to integrate cutting-edge technology into healthcare, particularly in early cancer detection and precision treatment. Yet, on the same day, a federal judge issued a ruling blocking the diversion of FEMA funds for partisan projects, a decision that underscores the tension between executive ambition and judicial oversight. Together, these developments highlight two defining forces in American governance: technological advancement and institutional accountability. Summary of events. Trump's AI cancer initiative aims to leverage artificial intelligence to revolutionize cancer diagnosis and treatment. The $50 million investment is intended to support partnerships between the Department of Health and Human Services, the National Institutes of Health, and private sector leaders in biotechnology and data science. The funding will go toward developing AI models that can detect cancer earlier through medical imaging, predict treatment outcomes, and accelerate drug discovery. Trump framed the program as part of a broader vision to end cancer as we know it, echoing bipartisan goals from past administrations. The initiative is expected to prioritize transparency, public-private collaboration, and open data sharing among researchers. Supporters hailed the move as a significant investment in life-saving innovation that could yield long-term healthcare and economic benefits. Meanwhile, a federal judge struck down an attempt by the administration to reallocate FEMA disaster relief funds to politically aligned projects unrelated to emergency management. The ruling reaffirmed Congress's control over budget appropriations and restored billions in funding to natural disaster recovery programs, including hurricane and wildfire response efforts. The court held that diverting such funds would set a dangerous precedent, blurring the boundaries of executive power in budgetary decisions. Analysis, reasons behind the initiatives. The dual developments, one advancing innovation, the other reaffirming checks and balances, reveal the broader dynamics of governance, policy, and public trust. Scientific imperative. Cancer remains one of the leading causes of death globally, with more than 600,000 Americans dying each year. Traditional research and treatment methods are often slow and expensive. By introducing AI, researchers hope to identify cancer biomarkers faster and more accurately, develop tailored treatment plans, and reduce costs associated with clinical trials. AI-driven tools could analyze massive datasets, recognize microscopic anomalies invisible to the human eye, and enable predictive diagnostics years in advance. Political motivation. For Trump, the announcement also serves a political function, signaling a forward-looking, problem-solving image amid a polarized national climate. Health innovation is a rare area of bipartisan appeal. It allows political leaders to align themselves with progress while sidestepping ideological battles that typically dominate U.S. discourse. Judicial oversight of FEMA funds. The blocked FEMA diversion reflects the judiciary's continuing role in maintaining fiscal integrity and preventing political manipulation of federal disaster relief. FEMA's core mission is to provide rapid assistance to Americans affected by natural disasters. The attempted redirection, whether to campaign-related projects or non-emergency infrastructure, risked undermining public confidence in government priorities. The ruling reinforced a vital constitutional principle. Congress controls the purse strings. Consequences and broader implications. For science and healthcare, if implemented effectively, the AI Cancer Initiative could accelerate a new era in medical innovation. By funding early-stage projects, the program may attract additional private investment and inspire global collaboration. The ripple effects could extend beyond oncology, shaping how AI is applied in cardiovascular disease, neurology, and rare disorders. However, ethical and privacy concerns persist. The use of patient data for AI training must comply with strict data protection standards to prevent misuse or bias in predictive models. For governance and accountability, the FEMA ruling restores confidence in the rule of law at a time when public trust in institutions is fragile. It reinforces the judiciary's function as a check on executive overreach, a reminder that even ambitious policy goals must adhere to legal frameworks. By restoring disaster relief funds, the court ensures that vulnerable communities affected by hurricanes, wildfires, and floods are not deprived of essential aid. For public perception, the juxtaposition of these two events paints a complex picture of American leadership, visionary yet constrained. On one hand, bold investments in AI cancer research demonstrate national ambition and faith in innovation. On the other, the judicial block on FEMA fund misuse underscores the importance of ethical governance. Together, they illustrate that effective leadership requires both creativity and accountability. Predictions: scientific advancement. Over the next 5 years, AI-based diagnostic tools are likely to become a cornerstone of cancer research worldwide. The $50 million pledge may attract additional billions in private and philanthropic funding. Policy expansion. Expect follow-up initiatives focused on AI applications in drug discovery, mental health diagnostics, and pandemic prediction models. Legal precedent. The FEMA case could shape future rulings on executive spending power, influencing how administrations manage disaster funds and emergency budgets. Public opinion. Trump's health-focused investment could soften partisan divides, as AI-driven medical breakthroughs are generally perceived as apolitical and beneficial to all Americans. Proposed solutions and future directions. Integrated AI Research Network. Establish a national consortium uniting universities, hospitals, and tech companies to share cancer data securely and accelerate breakthroughs. Ethical oversight. Create an independent AI ethics board to ensure that research algorithms are transparent, unbiased, and patient-centered. Long-term funding commitment. Transition from one-time pledges to sustained multi-year investments to guarantee continuity in medical research. Public awareness campaign. Launch nationwide education programs to explain the benefits and limits of AI in medicine, helping to build public trust. Reinforce budget integrity. Following the FEMA case, Congress should codify stricter controls over disaster funding reallocation to prevent future misuse. Conclusion: Trump's $50 million pledge for AI cancer research and the concurrent FEMA ruling represent two sides of the same coin: innovation and accountability. One aims to push the boundaries of what technology can do to save lives. The other safeguards democratic principles by ensuring public funds serve their lawful purpose. Together, they reflect a broader truth about governance in the modern era. Progress must walk hand in hand with responsibility. The challenge ahead is not only to cure diseases, but also to preserve the integrity of the institutions that make such cures possible.